So here we are on the downtown health sciences campus at Augusta University. This is Laney Walker Boulevard. You'll be spending a lot of time here as a new nursing student, and I want to talk about your first semester of nursing school classes. As you can hear behind me, you've got the train tooting off, and some people actually park over there on the other side of the train tracks from Laney Walker Boulevard, and that can throw a big monkey wrench into going to class on time and everything. So I highly recommend getting to class early. Nobody likes jumping through moving trains. Another thing I'd recommend is when you're watching these videos is to go up in the upper right hand corner. There's 3 dots. If you press that, you can increase the playback speed to 1.75 to 2 times speed. In nursing school, you'll have recorded lectures, and watching things on a quicker speed, if you can process it, helps out tremendously. And the same thing with YouTube. So the quicker you can get through it, because some people talk a lot slower. I talk a lot slower because I'm trying to choose my words carefully and think about it a little bit before I spit it out. So we're going to bounce around the rest of the campus, and I'm going to keep talking about the first semester. So behind me now is the health science building. That's where the College of Nursing administrators and staff all live. They're on the 5th floor and the 4th floor. Some of them hide on the 4th floor because their offices are there. It just depends on the professor. Keep in mind that the professors who teach these courses may change and the layout of the courses may change. But as of my experience of taking these back in August of 2020, here are the courses and the corresponding professors. So you're going to have Nursing Fundamentals with Rebecca Rule. Then you're going to have Health Promotion and Nutrition with Carol Hunter. Pathophysiology with Kitty Garrett, and Health Assessment with Diane Robillard. So let's break down each of these courses now. Nursing Fundamentals. Professor Rule is a very professional person who cares a lot about the profession of nursing. She's going to make sure that you get things right, and she can be a ball buster at times. But just know that she means well, and as long as you're paying her the respect she deserves, she'll return the same to you. Nursing Fundamentals is going to be the most challenging course you take this semester. It's kind of like Mr. Miyagi and Karate Kid going wax on, wax off, and that's going to prepare you to be well equipped to taking your boards, the NCLEX, once you're done with nursing school. So in Nursing Fundamentals, you are going to have simulation, skills, and clinicals. And we'll be jumping around to where simulation and clinicals are a little bit later in this video. Nursing Fundamentals is the essentials of nursing. How to make a bed, how to put a bedpan underneath a patient, how to roll a patient, how to wipe bottoms, how to provide trach care, all sorts of things like that. It's the backbone of nursing. And you're going to feel a little uncomfortable, to be honest, when you're starting out with your clinicals and dealing with real-life patients. But just know that when that timidness you feel is common for all nursing students. And it's easy to work through, and once you overcome it, it's just like breathing. It's secondhand nature. So one thing with Nursing Fundamentals I would recommend is be very diligent about preparing for your pre-lab quizzes. You will watch these video modules that are from the 80s. They're a little outdated, on Evolve Elsevier, which is a publishing company, and brush up on those skills and learn how the official NCLEX style of providing patient care works according to those videos, and take the quizzes at the end. They have them if you click through the tab, and that'll help you be well prepared for your lab quizzes and for when you go into skills fair. I remember that being a very stressful time. Now for preparing for nursing fundamental exams, I would highly recommend reading through the book. I know, reading through a textbook in college, who's heard of that? But I would highly recommend going through the textbook and picking out key terms and doing this prior to lectures. So let's say on Monday, well, let's look at our calendar. So Nursing Fundamentals was on Tuesdays. So that weekend before Tuesday, we'd have a lecture on legals and ethics and healthcare and nursing. I would go through the textbook and write all the key terms down. That way when Professor Rule or our guest lecturer, Ms. Rutledge, is telling you about legal and ethics in nursing, you already have the notes there and you're only writing down extra things. Another thing that will give you a good leg up in preparing for exams in nursing fundamentals is going to the end of every chapter and going through those questions. And I personally hand wrote them down and wrote down the rationales, A, B, and C, all of the above. You can also do Quizlet, and studying those and starting to think like a nurse as far as NCLEX style questions go. That will help you prepare for Professor Rule's exams. I think that's all that there is for nursing fundamentals. It's the most intimidating class, and it definitely will be breaking you in. So some of you might be thinking, I mentioned simulation earlier. What is simulation? It sounds fancy and cool, like VR goggles. Med students use that, we don't yet. But what it is it's a scenario. So you're given a case beforehand. Okay, here's the patient, here's what's wrong with them, here's why they're coming into the hospital. And you do it and you do homework on it beforehand. You're learning the meds you're giving and why you're giving them. You're learning a little bit of context about what's going on with the patient. And then you come to the Sim Center, which is here in the Hamilton building. Not the Hamilton building, I forget what this building's named, if I'm being honest. But so you come in a conference room like this, and you all sit around and you hash out and talk about the paperwork and the case on the patient that you're about to go see in the simulation room. So you talk about basically the worksheet you filled out and your nursing diagnosis, and then you go and you act it out, and something might go wrong, something might go well, and that's what happens in simulation. The good thing to know about simulation is that you're allowed to make mistakes. In fact, we would rather you make mistakes here in simulation than in the hospital when a real patient's life is on the line. So don't be afraid to, go out of your comfort zone and do something, because it's just a robot. It's just a simulation. If you make a mistake, nobody's life is on the line, and you learn from it. And then after you carry out the case, you all come meet back in the room and you talk about what you experienced and what you could have done better. So that's a little breakdown of what simulation is. Now we're going to go jump into one of the rooms, and I'm going to show you a simulated patient. Here we are inside a simulation room. As you can see, you've got the patient right there. You have an actual real-life hospital bed that functions. Mind, it is a little outdated, but it still serves the function of teaching you about a hospital bed. You've got oxygen on the wall like you would in a real hospital. You have suction on the wall. You also have an incentive spirometer, a urinal. All the things that you would imagine would be in a real patient's room is what you'll find in here. So I'm going to jump around. And so one cool thing about these patients is they actually have a pulse. And it's automated to simulate what a pulse would feel like on a real patient. And they're very reactive. They have lung sounds. They have heart sounds. There's a monitor right up there to tell you what's going on with the patient, from blood pressure, respirations, SaO2, heart rate, respiratory rate, the works. It's awesome. So the next course that I want to talk to you about is Pathophysiology with Kitty Garrett. If you ask any Augusta University College of Nursing alumni who their favorite professor is, chances are they'll say Kitty Garrett or Diane Roblard. They're very warm and they stick out in your mind and memory as professors. So pathophysiology, think of it like Anatomy 3. So all the concepts that you've been learning from Anatomy 1 and Anatomy 2, well, guess what, baby? We're putting that all together, and we're learning about what happens when things don't go well. Go well with systems like your kidneys, your heart, your lungs. It's learning those fundamentals of what makes a sick patient sick and learning those diseases. Pathophysiology is a very interesting course, and you need to be sure that you pay extra close attention in this class. Personally, for me, I did well just off of studying from PowerPoints. The textbook was supplementary. I didn't use it a whole lot, if I'm being honest. But pathophysiology is an awesome course, and the more you learn in that class, the more you'll succeed as a nurse in knowing how to diagnose and treat patients and what to look for and everything. All right, so the next course I want to talk to you about, this is now 3 out of the 4 courses that you'll be taking for your fall semester of nursing school at Augusta University College of Nursing. That's health assessment. This is going to teach you how to look at patients and think like a nurse. going all the way from the head down to your toes. So that means you're assessing your eyes, your ears, your mouth, your nose, your neck, your throat, all of that good stuff, all the way down to your feet, your heart, your lungs. This is what makes a nurse a nurse. You will have skills. The skills fair and lab encompasses in your health assessment course is preparing for that big head to toe assessment at the end of the semester. So that's memorizing all the cranial nerves. It's not that intimidating, and once you kind of get a workflow, you find your own style of how to assess a patient from head to toe. This is a crucial skill in nursing, and it's like an art form. Everybody has their own style of assessing. I would not panic about memorizing a script. I personally just kind of did it freestyle, you know. I read through the script a couple times of what I had written out, and then after that it was a freestyle, and it just kind of flowed and came naturally, thinking from your head to your toe. So that's health assessment, and that's going to be taught by Diane Robillard. All right, now it's time to talk about our fourth and final class that you'll be taking for your first fall semester at Augusta University College of Nursing. That's going to be health promotion and nutrition. It's a holistic way of looking at medicine from what your patient's eating and things like that. I would not stress yourself out about this course. It is an informative and fun class. Don't need to panic about it. So if we were to recap everything we've talked about for your first semester in the fall at Augusta University College of Nursing, you got nursing fundamentals. That's going to be your hardest class with Rebecca Rule. Then you've got pathophysiology with Kitty Garrett, learning about diseases. That one's going to be interesting. It won't be break your back challenging, but it is challenging. You have to study. Health assessment with Diane Robillard, assessing a patient head to toe. That one's enjoyable. And for health assessment, I would recommend reading the textbook and looking at some diagrams and charts. She likes to use those, and that will give you a leg up in that course. And then health promotion and nutrition with Carol Hunter. That one, just prepare for the midterm and final, but it's not insanely challenging. So that is everything you need to know for starting in the fall of nursing school for your first semester. Don't stress out too much, but do treat it kind of like a 9-to-5 job. If you don't have class one day and nothing going on, crack open one of the textbooks, like fundamentals, and be preparing for your next lecture. If you're disciplined in that regard for preparing and studying for the course, you'll be well equipped for all of the exams and everything. If you have a day off, and sometimes you will find yourself on days where, you know, there's always an assignment to do. For pathophysiology, you'll have these online modules that you need to do. And if you have a day where you're caught up on all your notes for fundamentals and pathophysiology and health assessment, knock out some of those patho modules. If you guys have any questions, feel free to shoot me an email, and I'd be more than happy to answer any questions you have. Stay tuned for our breakdown of the spring semester of your first semester in nursing school, followed by the summer gap. I'll probably talk about the summer gap at the end of the spring semester video, and then we'll have the fall of your senior year of nursing school, and then the spring, which is what I'm in right now, of nursing school. So stay tuned. I'm going to be cranking them out, and yeah.